Hi, my name is Dr. Jeff Dodge. I'm the president of the Rhode Island Oral Health Foundation and the co-chairman of the Rhode Island Mission of Mercy. I'd like to take this moment to welcome you to the 2013 Rhode Island Mission of Mercy project and thank you for taking your time to volunteer to join us this year. This year is our third Mission of Mercy event. The first year we saw slightly over 800 patients. Last year we saw 925 patients. And this year we have a slightly more ambitious goal. We're seeking to provide definitive treatment and dental care to 1,000 patients. I'd like to take this opportunity to thank you for volunteering your time with us this year. I realize that we all have many strings and many things pulling us in different directions. The fact that you're taking time to join us here and support the Mission of Mercy project, we sincerely appreciate that. I'm going to take a little bit of time here and review some information which is specific to the community volunteers for our event. First of all, know the community volunteers are very important to making our whole program successful. Without volunteers, there would be no Mission of Mercy project. The community volunteers function to help everything run smoothly and efficiently, getting the patients where they need to be so they can get their needed treatment done. As a volunteer, check-in volunteer, you serve as the welcoming committee to our incoming volunteers. This is a fun and exciting place to be as you witness firsthand hundreds of volunteers coming through the doors at the Community College of Rhode Island, all with one goal in mind, helping their neighbors in need. Truly a sense of community. As a patient escort, you will be asked to help to move the patients through the clinic in an efficient and expeditious manner to help get their treatment done. Many have been waiting for very long periods of time. Many patients wait outside overnight. They've been in some waiting rooms during the day. Many of them are anxious. All of them will be tired. Remember, it all starts with a smile. Greet them with a smile, some small talk, some conversation. It all goes a long way to help the patient to feel comfortable and less anxious about the treatment they are about to receive. You may be helping us out in the role of an interpreter. We have many non-speaking patients who come to the Rhode Island Mission of Mercy, and being able to bridge that communication gap is a huge must for us. It's a huge plus. With anything we do in life, we all know how important communication is. Many of you will be volunteering in the food service area. Please be aware, that's the beehive of activity during the Mission of Mercy. We have a crew that prepares meals for the patients as well as the volunteers. So during the course of the weekend, everyone gets fed. We have a volunteer lounge area where the volunteers can go periodically during the course of the day for breaks. We provide lunch, we provide breakfast, we provide snacks in between. I just have a few bullet points I'd like to review with you just to help the weekend to go a little bit more smoothly, to help your volunteer time be a little more efficient for you. Once you arrive at the clinic and once you get checked in as a volunteer, you will be directed to go to your specific area where your lead for that area, quickly identified by the black t-shirt, will give you an orientation specific to your duties in that shift. Feel free to communicate with your leads anytime. Again, communication is important. If you have questions, please ask. If you have comments, please pass them on. If you notice something that maybe could be done differently to make our program more efficient, please step up and speak about that. We welcome all comments. Should some of your questions be a little more detailed toward dentistry, look for a dental clinical lead. They can be quickly identified wearing blue scrub tops. Please be flexible. You may be asked to move to a different area or asked to help with something different. Please be assured that if you're asked to move somewhere or do something different like that, it will be because that's where you are needed. You may be working there with other people who are also slightly out of their comfort zone, so realize every job is important and just cut people a little bit of slack. We're all sometimes not doing exactly what we'd like to do. As with life, things change very quickly, so be prepared. Along the lines with be prepared, the Boy Scout motto, please take a minute to look and see if there's any exits near you. If you happen to be near an exit, please be prepared in the event of any type of emergency situation that you may be asked to help direct patients out of the building. Try to do that in a quickly and orderly manner. Your leads will be there, again, be there to help you out with that project. And we may be in a position where, should that happen, you will be outside, you may be asked to do something else or to keep an eye on people. Those instructions will follow. But just be aware if there's an exit, and please be prepared to help out if the need arises. We don't like to have the patients wandering around without an escort. So if you see a patient that's there unescorted, please look into that and at least point it out to your lead, so we can follow up and make sure we find out where the escort is, and so we know where that patient is. Please remember to stay hydrated. Remember to have something to eat. Take a break every now and then, a change of venue. Go down to the lounge. We have food down there. We have drinks. There's water throughout the clinical area. Just let your lead know you're going to take a 5-minute break. Wander down. Just to, stretch your legs. Just be aware that the shifts are long, the time is long, and we need to have a little something to drink and eat every now and then. We hope that you will finish up your experience, your volunteering experience, with some memories that will stay with you for a long time, and kind of a nice renewed sense of community and of belonging. The patients are very appreciative of what we do for them over the course of this weekend, and understand that you're a big part of what gets done. Every job is important, like the jigsaw puzzle. Each of those pieces fit together to form the whole puzzle, all of which is very important. So please enjoy your time here. We're very appreciative that you've come to help us, and we look forward to welcoming you at the Community College of Rhode Island, Flanagan campus in Lincoln, on Saturday, the 31st of May. Thank you.